Welcome back to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. I'm Dr. Dan Ronel, a plastic surgeon, here with my wife Betsy Ronel.
Hello again.
We're talking about what's new these days, and we were just talking about an article in Allure. And I want to talk about something that's about to come over from Europe that I've been waiting for about 5 years. Polydocanol. What the heck is that?
Goodness. What is that?
It's a great way to treat spider veins. And those little tiny veins that are mostly on the legs, but also on the face. Up till now, they've been treated with sclerotherapy, which is an injection of an agent that really irritates the blood vessel, and then it scars down and it goes away. And it's quite effective, but it hurts, and it can cause infections, and it can cause little ulcers in the skin, and that's not good. Polydocanol, for whatever reason, is much easier to use, much less painful.
What is it?
And
just get to it. What is it?
Oh,
is it a shot?
It's a shot, yeah, it's a shot. It's a shot that's injected with a very fine needle right into the vein. So I have a laser that Marion Urban runs that is also good for some spider veins.
On the face, yeah.
Oh, both on the face
really?
and on the
Okay.
legs.
And
a combination of a laser and this injection is going to be fantastic. It's
who administers the injection? You?
It'll be I who does it. Perhaps I'll teach Marion how to do it,
nice.
but I'll certainly start just to get it going and to make sure it works. And I'll probably be one of the first docs to use it here, I think, because
excellent.
the company that I'm on the medical education faculty of the company that's going to bring it out.
Hey, don't joke about that, man. That's a very big deal.
I can't tell you who it is yet.
Okay.
Yeah, FDA
I don't even know this, people.
Okay.
This is news to me. How funny.
There's 120, 150 doctors across the country that are on the MEF, as they call it.
Very good. Dr. Ronel is one of them.
So anyway, so I'm looking out for that. That's going to come soon. Now about veins.
Yeah.
You know, if the veins are bigger than spider veins, you can't, that's the whole thing. Lasers don't work, injections work sometimes. You have to go see a vein expert, a phlebotomist. There's one in town, Dr. Smith, there's one in Albuquerque, Dr. Pelosi, and they're the ones that I refer all my patients to who have big
chunky suckers.
Veins, you know, real, true varicose veins. And it can be really complicated to treat those.
Yeah.
But the much smaller ones are going to be treated by plastic surgeons and dermatologists, and I'm sure everybody else is going to start getting into it once this stuff gets out.
Yeah.
But that's something I'm very excited about because, I mean, I'm interested in taking care of the whole body. We've talked about this before. If somebody comes in for a breast augmentation, we'll look at everything else. Do they need teeth work? Do they need to see a psychologist? Do they need to see a nutritionist? Because, you know, if you come into my office, I see that as an opportunity to treat everything. And so I haven't
inside and out.
Inside and out. And I haven't been able to do that for the legs, spider veins.
Yeah, he's been actually talking about it for a couple of years now, and he hasn't been comfortable with what's existed prior to now. So it's funny, he came home today, he's like, I gotta talk about this, I gotta talk about this. And I said, hey, you're in luck, it happens to be in this article I want to talk about.
Yeah, so I'm keeping my fingers crossed that this will be something that is really going to work.
I'm sure we will advertise it heavily, so you will all know, Santa Fe, you will all know when the doctor is doing it.
Yes, yes.
All right, good. So, okay, so let's see. I want to just talk more about these famous faces because it's a common thing that we can all look at easily. You know, I said Demi Moore before. She really looks fantastic. There's another one, and she's what, 50? Or, pardon me, you know, maybe younger than 50. And then you've got this supreme-looking being in here, Heidi Klum, who's had, what, 4 children? Shoot, I've had 2, and I don't look half this good. I mean, these women are naturally, you know, genetically gifted. That's why they do what they do, or they can do what they do. But, I mean, what is the way that Demi Moore, for example, or, you know, Michelle Pfeiffer, or Sharon Stone, or Meryl Streep, or what is the way that they're keeping themselves looking so sort of pert, but not overly done? I mean, they look awesome, and naturally so, but it ain't natural.
They're intelligent. People who have a lot of resources and who have great advisors, they eat right, they exercise correctly,
They sleep enough.
They sleep enough, I was about to say that, right? They treat their allergies as soon as they start. They do all the things, the little things that add up that make everybody else, all of us, look tired and aged and...
Well, I mean, they've got other people who they trust to pick up their children.
Right, because...
They have, you know, people to walk their dogs. They have
right, and this is their life, is to look good. And so they have... And you can do this all. All of the stuff that they do, anybody can do. It just has to, it has to do with cost, it has to do with logistics and organizing it. And as you know, a lot of famous people get facelifts or eyelid tucks and they look terrible.
Right.
You know, that's not the answer. You know, surgery is not always the answer, or even fillers or getting your lips done, because they can be overdone.
Right.
You can have reactions to them. So that's not the entire story. It's a whole being thing. They go see their analyst so that their stress lines goes away. They also get Botox so that their stress lines goes away.
Right. They cite in here also yoga, and not this Americanized version, which I personally do not like, this crazy vinyasa. It's like a race to see who can do this poses the fastest. I don't like any of that. I refuse to do that. That's not yoga to me. It's talking more about the kind of yoga I like, which is the meditative, concentrating on your insides, you know, really focusing on your inner person, and
I mean, some people use yoga in order to work out, and that's fine. That's a different type of yoga, like Bikram yoga, to sweat everything out.
I'm not talking about Bikram. I'm talking about what America has done to vinyasa and, you know, all that. It's nuts, in my personal opinion.
Okay.
Unprofessional opinion.
If that's what you're doing, keep doing it, because it's healthy. Even if you're not doing it in the way that what's that guy Iyengar, one of the fathers of
right.
It may be different.
You know, Daniel doesn't know what he's talking about in this world, but you know, it says, you know, don't. They're not taught. They're specifically saying they're not talking about this crazy athletic type of yoga that America has sort of revolutionized. They're talking about the calming, peaceful vinyasa that goes peacefully with your breath, not erasing. I mean, I was in one of those classes. I almost fell over. I mean, it was ridiculous. And I'm pretty darn good at yoga, and I'm pretty in shape now. I mean, I couldn't keep up with women in their 60s because, I mean, it was just like a competition, and I don't like that. There was another thing I'm trying to find in here which I liked. Oh, another tip they said to looking good is my favorite. Have sex at least 3 times a week. It gives a youthful appearance. It can make you look at least 10 years younger. So everybody grab a partner and get to work. But what about, you know, the different types of fillers? There's a dermatologist cited in here that says one type is about to go out of fashion, perhaps.
Okay.
And I'm trying very quickly while we're on air to find it.
The ones that are going on, I don't know which ones.
Yeah, tell me.
Any filler that has a history of lumps and clumps and granulomas is probably going to go by the wayside, because the new ones are really smooth and they have a very low granuloma rate. The latest study on Artifil, for example, has a 0.01%, I think 1 in 1,500 rate, which is fantastic. So anyway, we have to wrap things up.
Oh, we do? Oh, shoot.
Anything to say?
Oh, well, no, but keep juicing it up, everybody.
Okay,
any which way you can.
Coming for the Vanity for Charity Month. Profits going to a local school, thanks to the makers of Artifil and iFlow, the paint pump, and we will be back next week.
And thanks for all our listeners. We're really learning that we're having a more increased listener base, and we really appreciate it. And we appreciate any feedback, good or constructive. And, you know, thank you. We just appreciate you all listening, really.